Professor Fitzgerald, thank you for coming to talk to us today. You head a multidisciplinary team at the MRC Cancer Unit at the University of Cambridge. Tell us about your research that your group does.
Thank you. My work is on cancer of the esophagus, a particular type of cancer called esophageal adenocarcinoma in particular. And as you said, it's a multidisciplinary team which includes clinicians, both doing a PhD thesis and postdoctoral, as well as basic scientists, along with research nurses and administrators. And we really work together to try and understand the biology of the disease and then apply that to practical solutions, particularly for early diagnosis of esophageal cancer. That's in Barrett's esophagus before it becomes really aggressive and incurable. And of course some of this information might be also relevant for therapy.
Your seminar was entitled From Lab Science to Practical Solutions for Earlier Diagnosis of Esophageal Cancer. Could you tell us a little about esophageal cancer and why early diagnosis is so important?
So most cancers of the esophagus present at an advanced stage, and most patients don't know that they've had for some years a pre-cancerous condition called Barrett's esophagus. And unfortunately the survival rates are really poor for this disease, around 13% at 5 years. And although our treatments are getting much more sophisticated, when a patient's got a very advanced disease with lymph nodes involved, it is very difficult to cure them. So we think that early diagnosis is really the key to improving outcomes.
And how do you anticipate your findings will impact on patient diagnosis and treatment?
So we're trying to understand the disease better, and so we're part of a large-scale international project called the International Cancer Genome Consortium, in which we're trying to understand the genomics of this disease from the earliest stages of Barrett's right through to advanced adenocarcinoma. And we're complementing that with laboratory functional studies to really understand what the key events are, the timing of those events, and when you really have an inevitable situation where cancer will follow on from the Barrett's. And if we can understand that pivotal step between benign disease and invasive disease, and then apply that to a diagnostic strategy, then that should improve outcomes. So what we've been doing in parallel to understanding the disease is also trying to develop the diagnostic. So we think that having cell material is essential so that you can then measure the things which seem to predict cancer. So we've developed a cell collection tool called the Cytosponge, which is a very easy to use device which can be used in primary care just to collect a very good sample in the outpatient setting in a very cheap way. It's a little capsule on a string that you swallow, and 5 minutes later the capsule has dissolved and you just pull out a sponge and you collect a lot of cell material. And if you couple that with molecular tests for the changes which we think are vital for that transformation from benign disease to cancer, so then you could come up with a much better diagnostic strategy than endoscopy, which is what it's currently all based on.
Oh, that has to be a good thing. Well, thank you, Professor Fitzgerald, for joining us today.